The faces of the Western Hemisphere. Faces as varied as the continent itself. Faces that reflect the drive and vitality of diverse regions and countries. Faces that reveal different stories. 100 years ago, the picture of health was a different one. Faces often were marred by diseases such as smallpox. Faces with fear that children would be crippled by polio. Still other faces, mirrors of the torment of living and working in subhuman conditions. The illnesses that were, coupled with the dreams of what could be, led to the creation of a regional health organization that was destined to become synonymous with health and well-being in the Western Hemisphere. Today, 100 years later, that organization is known as the Pan-American Health Organization. Each healthy face we see now in the Americas and the Caribbean represents the collective hard work of often anonymous faces: doctors, researchers, health workers, engineers, administrators, volunteers, and so many others. The smiling face of a child represents a commitment to reduce infant deaths and eliminate diseases, often with measures as simple as oral rehydration or the use of vaccines. A vision of determination was etched in history by thousands of health workers and volunteers working together throughout the Western Hemisphere to end smallpox, polio, and measles. Once seemingly impossible tasks become achievements. The face of a new mother, a reflection of those working to improve maternal and child health. New policies, better coordination, and increased education all contribute to save the lives of women and children every year in the Americas. A face that wears its lines and creases with pride and dignity, testimony to the efforts to extend quality of life to all age groups. The concept of active aging is spreading throughout the Western Hemisphere. Faces around the table. From the farm to the family, food is safer than ever, mainly due to public health work on the distribution, preparation, and handling of foods. In some parts of the Americas, faces still light up with wonder when the turn of a faucet brings a stream of clean water. Safe water is available to more and more people, reducing disease outbreaks and childhood deaths. Faces emerge from the shadows of discrimination and stigma as mental health issues come into the open. Faces tell the story. Spending on health is not only an investment in people, it's a crucial factor for economic development. The Pan-American Health Organization seeks new approaches to the never-ceasing challenges to health in the Western Hemisphere. Chronic diseases, equity, gender issues, providing safe blood. From hurricanes, earthquakes, and other natural disasters to new and re-emerging communicable diseases that can travel across the seas and skies. From the hazards of tobacco and environmental degradation to the pandemic of HIV/AIDS. To fight and prevent these and other threats, the Western Hemisphere will continue to rely on the dedication and expertise of countless faces. Because behind every accomplishment in health, behind every favorable statistic, there are the faces of those who work to make them happen. The Pan American Health Organization, celebrating 100 years of health.